The question is, which of the following amongst these is not an endodontic emergency? So, uh, usually you do an endodontic treatment. Emergency for endodontic treatment is done in certain specific cases. Now, what is this emergency management is? When the patient comes to you and has undergone any form of trauma or is basically in a position where the pulp is in a state of inflammation to the extent that the patient is unable to deal with some form of is unable to deal with the incident of irritation that the pulp has undergone. You need to perform some form of treatment to the patient so that the patient feels comfortable. See, all pulpal issues are going to be manifested to the patient as pain. However, the extent to which the pain is going to be tolerated by the patient determines your emergency. Now, most patients, what happens is there are certain set of patients who have pain. The pain becomes unbearable. Eventually, the pulp reaches a state of necrosis, and once it reaches a state of necrosis, the periapical tissues form a periapical abscess. Now, once an abscess is formed, the abscess may grow in size, continuously grow in size, and there may be an extraoral swelling that may be visible. So when you have an extraoral swelling, you have to take into consideration that an emergency root canal opening would have to be performed for such a patient because of the excessive extraoral swelling. You need to drain, basically you need to drain the abscess so that the entire swelling gets decreased in size. Okay. Now, what you do is, there are situations in which an emergency is not needed. One more situation when an emergency will be needed is the patient is in excruciating pain, like severe excruciating pain, and what such a patient is has to undergo root canal treatment, because despite giving your entire analgesic therapy, where you're starting with an acetaminophen and then you're giving a stronger analgesic and then you give an even more potent analgesic, despite all of that, the patient's pain threshold is less and the patient is continuously complaining of pain. In such or under such a circumstance or such a situation, what is going to happen is you would have to give the patient an analgesic, a very strong or you would have to perform a root canal opening in this position, in this case presentation. Sorry, why? Because the patient is in excruciating, intolerable pain, and in such a situation, the only solution is going to be to extirpate the entire pulpal tissue so that the pain of the patient is completely gone. Okay, so that again classifies as an emergency. Now, coming to the scientific terms, this is what was the basic, but coming to the scientific terms, let's look at our options and let me explain each option properly so that you will be able to understand. Asymptomatic chronic abscess. Okay, so you have an abscess, so that means it's a periapical swelling, and this periapical radiolucency or swelling has grown in size. However, despite growing in size, it has not irritated the patient. The pulp is completely necrosed, you have a periapical swelling, but the swelling is confined intraorally. It is not present extraorally. So, in such a situation, it is not considered to be an emergency. Why? Because the swelling has not reached to the extraoral manifestation, and you would rather give antibiotics in such a case so that you can decrease the size of the swelling and then perform a root canal procedure by performing an access opening and extirpation of the pulp. That is why the answer also over here is asymptomatic chronic abscess. Coming to irreversible pulpitis with a normal periapex. When patients who have irreversible pulpitis, the problem that is going to occur is that the patient is going to have severe excruciating pain. Now, when you have patients who are, like I had mentioned, the patient is going to have severe pain, it is going to be very difficult for the patient to understand that you cannot perform the therapy at a later point in time. And since the patient is in so much pain, the best way procedure to carry out in such a situation would be to directly perform an access opening. Third is symptomatic acute irreversible pulpitis from a necrotic pulp. Actually, this entire statement is wrong. This entire option is wrong, because you cannot have irreversible pulpitis and you cannot have pulpal necrosis. They are completely two different terms and two different terminologies, and they also exist as two different presentations. So this is makes no sense. So that is the reason why you cannot select it as an answer. And last is facial swelling from the necklace part. Like I told you, if you have an extraoral swelling along the lower border of the mandible, all along the infraorbital margin, the most important thing to do would be is to perform an access opening, puncture it, remove the extirpate the entire pulp, take your file and go beyond the apex so that it can drain from the canal. And in doing so, what will happen is the patient will end up feeling much more relaxed and the swelling will actually come down very soon. And of course, you have to give the patient a course of antibiotics so that the entire infection or the microorganisms are also taken care of.